So Addison's disease. Addison's disease can be primary, secondary, tertiary. So we know hypothalamus, pituitary and the adrenal gland. So primary, the pathology is in within the gland. So what is the reason? Autoimmune cause. In secondary, what is the cause? Problem is in the pituitary. In tertiary, problem is in the hypothalamus. So reason why you have problem in the pituitary, Sheehan syndrome or Simmons disease. Sheehan's obstetric cause, Simmons non-obstetric cause. Here you can be trauma or AV malformation and AV aneurysm rupture. Problem is in the hypothalamus. So in all this condition, there will be decreased cortisol. Decreased cortisol, decreased aldosterone, decreased sex corticoids. So the whole gland function is decreased. So what happens? Decreased cortisol, decreased sugar, hypoglycemia, palpitation, tremor, sweating. Aldosterone is less, so less sodium and water into the blood. So postural hypotension. Salt is urinated through. Salt is lost through urine. Salt wasting, polyuria. Potassium will increase. Then metabolic acidosis. Sex corticoid is decreased, so decreased libido, erectile dysfunction. When the cause is primary, as a feedback, ACTH will increase. In other cases, ACTH will be less. So here you get pigmentation will be present in primary Addison's disease. So you can take a CT of abdomen to know the damaged adrenals or MRI of brain to know secondary tertiary causes. What is the investigation of choice? ACTH stimulation test or co-syntropin test. In Cushing's disease, we have done one test, that is low dose and high dose dexamethasone suppression test. Here it is ACTH stimulation test. What is Addisonian crisis? It is a different term. After meningococcal infection or Pseudomonas infection and all, it can lead to sepsis, DIC. There will be adrenal hemorrhage. That condition is called Addisonian crisis. Okay. So the treatment, in each case, what is the treatment? In primary case, the treatment is fludrocortisone. So, primary case you have hydrocortisone. In secondary and tertiary you have dexamethasone. And in Addisonian crisis, hydrocortisone. So these are the treatments. What is Addison's disease? What is Addisonian crisis? Primary, secondary, tertiary. Where you get pigmentation. In here all the three hormones will be less. And what are the treatment? Then investigation of choice, ACTH stimulation test.